I'm Amber Lowe, and I work for the Mental Health Cooperative in Chattanooga, and we serve people in Chattanooga who have TennCare, which is Tennessee Medicaid, or people who fall below the poverty line.
In your profession or in your prior studies, have you ever learned anything about socialized healthcare?
Yes, when I was in college.
What can you tell me about socialized healthcare?
Well, in my mind, socialized healthcare is just the government highly funding the healthcare system so that the public gets healthcare free or at a very affordable cost.
As a professional, do you feel as though a socialized healthcare system would be beneficial for the Appalachian region?
Yes, I do. I feel like the Appalachian region has a much higher poverty rate, and therefore people in Appalachia could definitely benefit from having free or affordable health care. I see a lot of people at my office who don't have insurance, and therefore they aren't typically able to get services that we would offer. But Tennessee has a safety net service, and therefore we can provide services to those people. So I really think that if they had affordable health care for physical concerns, they would definitely be able to get those needs met.
In your practice, what concerns have you heard that people have about a socialized healthcare system?
Well, the biggest concern that I've heard about socialized healthcare is that the quality will go down just because we aren't paying out of pocket for services. And I think that that's really the opposite, because the average American household spends $8,000 a year in healthcare. Well, Japan, who's a similar country to us, their government funds their healthcare system, and therefore they're able to pay the average of $3,000 a year per family for healthcare costs. But the U.S. ranks 24th in life expectancy in the world, and Japan ranks first. So I really think that the quality wouldn't necessarily go down just because we're not paying out of pocket for those services. In fact, our quality should go up because the government is funding those things.
This slide is an invoice for American Medical Response with services to Peninsula Hospital and Medical Center. The total charges due are $1,788.22. The emergency transportation charge is $1,361.64. There is also a mileage charge of $105.30 and an overnight stay at the hospital of $124.18, as well as various other charges, including a saline solution at $57.73. Now, in other countries with socialized healthcare systems, these charges would have been substantially less. And if we, as social work students and future social workers, help to implement a socialized healthcare system in our nation, then services for people in Appalachia who are on a poverty-stricken income could be substantially less. What problems do you foresee if we don't have a socialized healthcare system in our nation?
Well, in the Appalachian region, people are at a higher risk for diabetes, heart disease, cancer, and that's because they can't afford to go to the doctor. So if we don't have a healthcare system, a socialized healthcare system, those numbers are just going to continue to grow, and we as social workers are neglecting the needs of the Appalachian community, and we're neglecting to give them the quality of life that they deserve.
As you can see in this slide, the color white represents the deaths from cancer from 1999 to 2007 and is less than 145. This area covers the easternmost part of Virginia and parts of North Carolina. The next shade in light blue is the deaths from cancer, and it is 145 to 160. The next shade is 160 to 175, which is also the U.S. average of 165 deaths from cancer per year. As you get closer to the center of Kentucky, parts of West Virginia, and into Ohio, you move from 175 to 190 to as much as more than 220 deaths from cancer per year. This slide represents health expenditure per capita from the years 2000 to 2011. The United States is denoted by the light blue line with crosses. In 2000, the average U.S. family spent $4,700 per capita. By the year 2011, they were just over the $8,000 mark. The next closest country is Switzerland, who are denoted by the red lines with the diamonds. In 2000, their per capita spent was just over $3,000. And by 2011, they had still not reached the $6,000 mark. Now Japan, which is denoted by the red line with circles, as Amber spoke of earlier, in 2000 was under $1,000. And by the year 2011 had just passed the $2,000 mark. The lowest country on this list is Turkey, who in 2000 was at around $500, and by the year 2011 had still not even passed the $750 mark. This slide represents healthcare spending as percentage of the gross domestic product. As you see, the highest country is the United States, who spent nearly 16% of their gross domestic product on healthcare. Again, the next closest country is Switzerland, who at this time was not even spending a full 12% of their healthcare spendings of the gross domestic product. Again, the lowest country on this list is Turkey, who is spending a little less than 6% of their gross domestic product on healthcare. This slide represents the total healthcare expenditure per capita in US dollars. The United States is on the right-hand side of the graph. The red line denotes 1995, where the U.S. averaged $3,500 in spending for healthcare expenditure. The green line represents the year 2000, where the United States had jumped to a little over $4,500. The blue line represents 2005, where the United States had increased to just over $6,500. And the yellow line represents 2007, where the United States had jumped to a little over $7,000. The next closest country is Switzerland. In 1995, they were at $2,500. By the year 2007, they had just reached $4,500. Again, Japan, a country that was mentioned earlier, in 1995 was spending just over $1,500. And even by 2007 had just passed the $2,500 mark. This slide again represents the U.S. healthcare costs per capita. In the year 2000, the United States averaged $4,878 per capita. By 2005, it had risen to $6,875. Again, in 2008, it had reached $7,922. And by 2011, it has increased to $8,680 in U.S. healthcare costs per capita. I would now like to read an excerpt from FAHE, which is a nonprofit organization that has been serving Appalachia since 1980. Appalachian poverty is a major problem, and it's a problem that goes largely unnoticed by the rest of the country. This is partly due to lack of awareness and partly to do with the fact that the country as a whole is trying to make an economic recovery. We hope that by seeing Appalachia's economic statistics, more people will take notice and help spread word of Appalachia's need. The Appalachian Regional Commission, or the ARC, reports on Appalachian statistics such as poverty, income, and employment. According to their 2007 to 2011 report, poverty rates across the U.S. was 14.3% compared to 16.1% in the Appalachian region of Alabama, Kentucky, Tennessee, Virginia, and West Virginia. Even within these states, there is quite a difference between poverty rates. For example, in Virginia, the statewide rate is 10.7% versus 18.1% rate for the Appalachian region. The state with the worst poverty rate in the region is Kentucky with 24.8%. versus 18.1% for the rest of the state. After seeing that nearly a quarter of Kentuckians are below the poverty line, it would be easy to assume that the unemployment rate would be to blame, but that isn't the whole story. In 2011, the unemployment rate for the U.S. and the Appalachian region was 8.9%, while Kentucky's rate was only 0.7% higher. So it would be best to look at the per capita income of Appalachia against the entire United States. One of the main poverty issues of Appalachia stems from the fact that the employed population of these states makes significantly lower amounts of money than the rest of the U.S. The per capita income of the Appalachian region of Kentucky is only $26,830, while the entire U.S. sits at $39,973. The number for the region, taken as a whole, comes out to $32,645, which is only 81.7% of the U.S. per capita income. I hope you have gathered from this video presentation that a socialized healthcare system will be vastly beneficial to the Appalachian region. With things such as diabetes and cancer being so prevalent in the Appalachian region, a socialized healthcare system would provide a better quality of care for all residents of Appalachia.